So if you were, let me walk through those symptoms separately, but if you were a patient and you are experiencing eye problems, what would you do next?
So I think we often come across this scenario in neurology practice. I think the first thing I would suggest is if you're having double vision or having some of the other symptoms that are related to the eye we were talking about, is seek medical help. Go to see your primary care physician, go to see a neurologist. Paraneoplastic syndrome is a differential, but it's not the most common cause for eye movement problems. When I talk to my residents or fellows, I tell them to rule out common things first. And then once you've ruled those out, think about paraneoplastic syndromes. There are certain individuals where paraneoplastic syndrome might be on the top of the list if the clinical story makes sense. For example, in a subset of patients who have history of cancer and now starting to develop these syndromes. Rarely we have seen those scenarios. That's where we think about paraneoplastic syndromes first. But in most of the cases, it's towards the bottom of the list, and the more common things come first, and it all starts with a detailed assessment by internal medicine provider and in terms of eye movement problems by a neurologist.